See the start shortly screen. As that comes down, we will start the session. Here we go. All right. Happy New Year. Mike Sokolowski. I'm Director of Grassroots Advocacy here in the Hearts for Home Care program, joined by a few of my colleagues today for our welcome and kickoff training and a little overview of what's to come. Very excited to be joined by two particular groups today. So everyone knows that's watching, Hearts for Home Care is made up of thousands of advocates who had registered to become the voice on behalf of those that are voiceless. Clients and field staff that don't have the opportunities like you to engage with legislators for a better home care ecosystem. Today is the kickoff on how you can get involved throughout the course of 2025 and beyond. The second segment of Hearts for Home Care are our grass tops advocates. They are members of Bayada Home Healthcare who have the opportunity to engage on behalf of those same clients and field staff. So again, Hearts for Home Care is a giant ecosystem of thousands of people that are able to engage on behalf of the home care industry. Our grass tops advocates, you will see people from Bayada Home Healthcare who are advocating with you as well. There's always a little confusion there, so I like to clear that up before we get started when we refer to ambassadors and advocates throughout the year of training. Without further ado, we are going to start today hearing from our President and Executive Director of Hearts for Home Care, Dave Totaro. Dave, take it away, my friend.
Thanks, Mike. Appreciate the opportunity to speak to everyone today. You know, this is only January 15th, and already it seems like we're facing one of the busiest years we've ever had. I think we're kicking off a year of change, a year where we're going to face a new administration, not only in Washington, but in many of the states that we support. We're looking at a new head of HHS, Health and Human Services, for the first time in over 4 years. And we're looking at a new head at CMS, an agency that controls much of what we do every day. But if we look at the past and look at the future as a symbol of what we've done in the past, I still hold a lot of optimism for the coming year. In fact, we ended 2024 with over 7,500 Hearts for Home Care advocates. That's an increase of about 1,500 over 2023, a 25% increase. And so for that, I'm thankful for not only the Hearts for Home Care team, but all of you who have joined us today and those who couldn't join us today, because I know that this is something that you're doing on a voluntary basis. You're all busy, and we appreciate every amount of time, all the amount of time that you can afford to help us in our mission to reach more and more folks to provide quality care for everyone who needs it. In 2024, we actually added over $430 million in additional funding for home and community-based services in all the states that we support as Hearts for Home Care advocates. We turned around some very deep cuts that we were facing in Medicare, and we opened up some very meaningful dialogue with CMS at the second half of the year, and we're hopeful that these kinds of discussions will continue for us in the new year. But I'm not going to be foolish to say that we don't have challenges. We recognize that we will have challenges. We're going to face significant challenges, particularly, and some potential chaos, particularly in the first half of this coming year, as any new administration usually indicates that there is change. But I'm optimistic, as I said, that we can achieve our results together. This past week, Maggie DePasquale, who you're going to hear from in a few minutes, she and I met with over 11 congressional offices in Washington, D.C., both sides of the aisle, and we had a very positive reception in every case. A deep understanding of the issues, both on Medicare and Medicaid, that we face, particularly from those who are members of the Problem Solver Caucus. This is a special caucus that was assembled, a bipartisan caucus from folks from both sides of the aisle. So let me just leave you with this one thought. Together, together we have the power to inspire change. So if we raise our voices together, and we can, as we have done in the past, we can make a difference. For that, I'm thankful that I have all of you, all 7,500 of you, and the fabulous staff that we have at Hearts for Home Care to not only manage change, to bring positive results. So let's have a great year. Thanks, everybody.
All right, and with that, I'm going to turn it over to the Director of Federal Affairs here on the Hearts for Home Care side, Maggie DePasquale. Maggie, what is going on?
Thank you, Mike. Hi, everybody. My name is Maggie DePasquale. I am the Director of Advocacy and Engagement on our federal side. So we have a lot of exciting things going on. We have a new administration coming in next week. President Donald Trump will be inaugurated on January 20th. Dr. Oz has been nominated as the head of the Centers for Medicare and Medicaid Services. That's an agency that presides over many of the programs that home health consumers rely on. We also have Robert Kennedy Jr. He's been nominated to the Department of Health and Human Services. Now, both of these appointments will require Senate confirmation, but they are both expected to be confirmed. We also have the start of a new Congress. The 119th Congress has begun. In total, there are 30 senators and representatives who have previous healthcare experience. They've had jobs such as nurses, doctors, all across the spectrum of services. So that's really exciting. The Preserving Access for Home Health Act was legislation that we had introduced in the previous Congress. Unfortunately, it did not pass. So by the end of the year, all bills that have not passed, they will die, and they are considered needing to be reintroduced in this coming session. So we are working on having that legislation reintroduced. And as Dave mentioned, the Federal Hearts for Home Care team has already begun to have really positive conversations with our senators and representatives in this new Congress. So there's a lot of work to be done, but we've already hit the hill and are having a really great time so far. A few predictions for 2025. MedPAC, which is the Medicare Payment Advisory Commission, they are an independent federal agency that recommends different things to Congress and CMS regarding Medicare. They have recommended an additional 7% cut to the Medicare home health payment rate. So that is something that we are really looking to have addressed. It's very concerning for our industry because that is an area where so many people rely on receiving that care, and the margins are already really difficult. We want to be able to recruit and retain and provide care to everybody who would like it at home. There is a focus on Medicare Advantage in the new administration, so it'll be important that we educate our new administration and new congressional members on the importance of traditional Medicare. And there are some proposed initiatives that the Trump campaign was speaking on and really focused on during their campaign time. So some of those are like reallocating resources to at-home care for seniors, removing barriers contributing to caregiver shortages, offering tax credits, and reduce regulations to support unpaid family caregivers. So there is a focus on home health care with this administration, and that's always something really positive that we are looking forward to. So we're excited to work with our new and returning members of the White House as well as in Congress, and it's a very exciting time for us. There's lots of new opportunities and lots of work to be done. Thank you, Mike.
Thank you, Maggie. Going forward from this point, we have chat, middle, center, left-ish, I guess is the best way to describe it. So if you have questions that you think of during this training, put them in the chat. We will monitor it as we go, and we'll take time during and after to get to these questions and get you answers. And also, if you have things that aren't related to this, but just advocacy and government affairs in general, put them in there. Don't be afraid. This is your forum where it's live to get answers that may help one of the other 79 people that don't want to ask a question get an answer to something they're thinking about. But with that, we are going to turn over to things that are important on your end as advocates that really help us go a long way throughout the year. I'm going to share my screen. So our biggest platform is the Hearts for Home Care website. If you have not visited heartsforhomecare.com, that is where you should go. So on there are a lot of resources available to you, learning how to be a better advocate, some one-pagers that walk you through how to get involved or get ready for meetings. We will always help you if you want to reach out to us, advocacy@heartsforhomecare.com. Easiest way to get a hold of any of us. However, getting a good look behind the scenes what's going on, this website is best for you. Now, why am I starting on this screen and not the main page? On your right, you will see report your actions. So for us, the Hearts for Home Care leadership team, in terms of using all of the information that we gather while you are out there engaging on behalf of clients and field staff, this is where we will learn about what it is you are doing throughout the year to better the lives of field employees and these clients. When you do click this button, I am not going to click it because I am logged in for this particular activity. But when you do that, you're able to tell us if you met with the legislator, if you sent an action order, if you invited a legislator to come to an office that you work in, wherever it may be, if you connected with someone in the community at an event, you're able to click that button and log it. And when I say log it, we have a system, it's called Quorum. It's our third-party vendor for the advocacy engagement. And again, some of these things we're doing on the welcome because we just want you to have an idea of why we ask what it is we ask of you throughout the year so that we are better prepared to engage with legislators on our end. So right here is a great example. Asa Smith is one of our Hearts for Home Care advocates. Recently, Asa invited a legislator, State Representative Carol Hill Evans, to their home care office to talk about what goes through the process of clinical people being vetted and ready to go out into the field to take care of home care clients, meetings on what is happening in this office in terms of staffing due to critical shortages on all ends, and ask questions of the representative on how we could better become advocates and work with Rep. Carol Hill Evans's peers on getting things done. That over here next to Quorum. So as you can see, all of the engagement that you as advocates do, we kind of get a look at and are able to pop in and provide the data to legislators when we are able to meet with them in the field. One of the things you are going to see when I say field, meet them in their district office, the Capitol, wherever it may be. One of the things that you will see not only from us, but us sharing our action alerts. So either our own Hearts for Home Care action alerts or those of state or federal associations. And once you see these action alerts and take action, we get the recording of you taking action. And then when we are able to have a meeting, such as yesterday, regarding federal affairs, Maggie and Dave were actually having meetings in Washington, D.C. They could bring the data that, look how many people in your district responded to an action alert supporting whatever bill or specific item it was that the alert was connected to. So we just want you to see behind the scenes why we ask these things of you and why it's super important to do the report your actions when you're out there engaging with legislators, because that information goes a long way when we have meetings with specific key legislators and try to move the needle based on facts and data. We're going to talk about the other part that's very important when these meetings happen a little bit later. You'll hear from Marissa. Newsletters. So in terms of us connecting with you, the Hearts for Home Care advocate, each month you'll get a newsletter from Hearts for Home Care in your email inbox. And in that newsletter, there's information on a variety of states that things are happening on a legislative side. And then also you'll see educational opportunities that are coming up, like this one today. You'll also get some interviews with advocates and why they do what they do, background on them, and other events such as lobby or advocacy days in states or in Washington, D.C. that are coming up, they are able to register for. So I said there's a second part to the facts and data. So when we utilize quorum for the facts and data piece for relevant meetings with legislators, there's always one thing that the legislators tell us in face-to-face meetings that mean more than the facts and data. And with that, I'm going to turn it over to my colleague, Marissa Fogel, who does a lot with this secondary piece of the meetings. Marissa?
Thanks, Mike. Thank you all for being here. It's exciting to kick off the new year with all of you, and we have lots of great opportunities and things to look forward to in 2025. Before I get to that piece that Mike was talking about, he also mentioned the newsletter, which whenever that is sent out, it'll be from me. So if you ever want to respond or have any questions, you can reply directly to that email, and it'll send it to my Hearts for Home Care email. You'll actually be receiving the first email newsletter of 2025 on Friday. So look out for that coming up. But as Mike was saying, one of the most important pieces in what we do for advocacy is what's called sharing your story. And you probably have heard us talk about this 1,000 times in 1,000 different ways, but we talk about it so regularly because it is that important and can make that much of a difference. When we are looking for stories, it can be anything from, hey, my grandparents are needing home care and they want to stay together in their homes and they need a little extra care and a little extra help. This is what their home health aide has done to help them remain comfortably and safe at home. Or it can be something like, I have a medically fragile child that, needs extremely skilled in-home nursing to keep them at home with their family. And without these nurses that come into my home, I wouldn't be able to go do my job, or my family wouldn't be able to have the peace of mind to live with my medically fragile child if it weren't for home care. So different types of stories, whatever they may be, we are looking for you to really explain to legislators the importance of home care and what it means to you. We have two different ways to do that, okay? And I think a lot of people on this call have already taken part in sharing their stories as maybe even why they advocate. But the two easiest ways to share these stories with us is through if you click on them, can you click on the message us one? Should take you to the right. So share your story. This is a really easy way to you'd sign up, write your name, your email, and then it would come up with a whole long list of things that you probably have to fill it
I
out.
can't do it because I'm logged in, yes.
Yeah. No, that's okay. But it'll give you an opportunity to just write whatever you want. And then that'll be sent to our emails, and either me or Mike or my colleague Elisa would reach out to you, and we'd just love to hear more and how we can utilize that story with legislators, with the media, on our social media pages, whatever it may be. And then there's also an opportunity to actually send us a video. And this is new. We just started this last year. But you can record a video directly on the website here through your phone or computer, and it can be about anything. We have, Mike, if you scroll down a little bit, we have some other examples of advocates that have already shared their story. If you want to get some ideas, we have some legislators who have also shared their stories about thanking home care nurses. This is what we did for Nurses Week last year. But we're looking for any and all personal experiences that you've had with home care, or maybe you haven't had a personal experience with home care, but you know that one day that you will, and you want to ensure that those services are there for you and your loved ones when you will need it one day. Just an FYI for 2025, the Hearts for Home Care team is going to be doing a lot of media campaigns, specifically in New Jersey, North Carolina, and Pennsylvania. And so we're really looking for any kind of nursing stories that you may have, whether it be kids who need skilled nursing at home, nurses who, love what they do and want to stay in the industry, but really struggle because there's just not enough funding. Or it might be, an adult who gets to live at home and has thrived at home their whole lives and wants to stay there because of home care. What we are looking for these stories specifically, like I said, in New Jersey, North Carolina, and Pennsylvania. So advocates and ambassadors, I'm talking to you. If you have any stories of incredible nurses or home care recipients that you think would be willing to share those stories with us so that we can get them to legislators and the media, please either email me or Mike or the advocacy inbox, and we would love to connect with those people. Before I pass it over to Mike, though, I did want to share a really good recap of 2024. I know we're in 2025, but I wanted to share a recap of all that we've accomplished in 2024. Thanks to all of you. We made this video, and I'm going to share my screen quickly so that you can check it out. Can everyone see my screen, Mike? Okay.
Yes.
So if you saw there was, going back to the share your story piece, over 50 media publications that we got from advocates just like you sharing their stories. That's an incredible number that we're really proud of. And over $433 million of state investments were made in 2024, thanks to your hard work. So it really does pay off. What we are doing is making a difference, and by you sharing your story, although you may not think that it can make an impact, it truly, truly can. So I will turn it back over to Mike, and thank you all for being here.
Thank you, Marissa. So what I'm going to do now really quickly is share my screen again. I wanted to show you just going forward on the website itself, Hearts for Home Care site. So here is, to give you an idea, all of the trainings over the next few weeks are Wednesdays at noon. And you will get the invite Wednesday afternoon for the next Wednesday. So just so you know, you're not missing invites. We send them out about 7 days prior. And we do that on purpose because we don't want things to get lost or too far out and get out of mind. So you will get the invites for these, but this at least gives you an idea of what is up. Right? And next week's, so not just us and the Hearts for Home Care team lead these particular trainings. However, we have groups come in, outside vendors, legislators, speakers, regulators. And next week, Reagan Communications Group is going to join Melissa and our colleague Elisa on working with the media and speaking in public on behalf of clients and staff. So again, extra special when we're able to get people, outside experts assist you in what you're doing out in the field. Then I wanted to show you one last thing. So here is on the Get Involved page, just to give you an idea of where we house a lot of the other opportunities that you have as an advocate. So the action alerts, they will live here, so to speak, and we have current ones for you to take action and respond on behalf of. On the top right here, one of the basic things we always instruct our advocates to work with their direct constituent legislators. They listen, those legislators, to you because you voted for them. We don't want really anyone meeting with just anyone, so to speak, that's a legislator. So how do you find out who yours is? Well, if you don't know that who you voted for, if you've been voting every year in general elections, you can go right here on the top right and learn about your lawmaker. It will use your name and address specifically to pair you with your state and federal legislators so you can learn more about them. And there's a profile in there. If you want to encourage others to join you, there's an option here on how to share joining Hearts for Home Care. We went over this share your story, and on the bottom right there, you could see social media pages, advocating from the desk, so to speak, we call it. That's great if you join us on our social media pages because you have the opportunity to push content where we're tagging legislators and giving you the opportunity to share it with your communities. Here on the resources page, there are a lot of opportunities for you to learn a little bit about what it is to advocate on behalf of our home care clients and field staff. Lastly, before we get into some Q&A, relationships. Relationships are key, not only having a relationship us with legislators that are in key roles, either in state or federal capital. Relationships that you have with legislators go a long way for when people like Maggie on our team are meeting with legislators. They're able to go into what we looked at first, forum and the notes, and see if Advocate Marissa Fogel has met at all with a legislator that's from the state that Marissa lives in. And if so, what did they talk about? Because if you're logging your interactions through the Hearts for Home Care page where it says to report your actions, and Maggie's about to have a particular meeting where facts and data matter, Maggie would be able to pull the results of the meeting with the legislator that Maggie is now going to meet with based on that. So when I say relationships, if you are a neighbor of a legislator, a relative, former coworker, play on an intramural soccer team with someone, whatever it may be, it is one of those, it's not too small for us to know about because it may work out in the long run. We had an advocate in Delaware, Brad. I don't want to give out last names, but Brad was friends and a colleague with a certain individual who became an elected official in Delaware and rose through the ranks pretty rapidly. And that personal relationship that Brad had was something that we were able to meet with that newly elected official and explain home care in a more comfortable way because Brad had already formed a relationship with that particular legislator. So let us know if you do have any relationships, be it professional or personal, with legislators, and how you could do that. Report your actions. You can go right to that page on Hearts for Home Care and let us know, or just send an email to advocacy@heartsforhomecare.com and let us know that, and we'll follow up. Last, in terms of contacting us for whatever it may be, so all of us have a different expertise in terms of advocacy and engagement with legislators. If you want any one-on-one support about an upcoming community event, about a meeting with the legislator in their district, about hosting one of those roundtables, if you work in an office, a home care service office, and want to have legislators come in, you are able to contact us ahead of time. We will work with you and walk through the logistics of what is going to happen, how for you to best prepare, and then follow up that is needed. With that, I am gonna pause for some questions. I know we have some in the chat, and Amy Everhart has her hand raised.
I
Right,
think Amy Everhart has a question.
yeah, and I unmuted. If you take yourself off mute, Amy, you are able to ask a question. Okay, maybe that was a sled. So we will move on from that. I unraised the hand. Maggie, I see you already answered yes. Anyone? The only restriction is United States. This is not an international organization. Not that we are looking to expand internationally at all whatsoever, but yes, it is only United States. That is the only restriction. Anyone else have any questions for the chat? Otherwise, we will let you go, as today was more of a broad brush preparing you, and then you see that the meetings on the events page are very specific going forward in terms of meeting with legislators, learning about public affairs, having a home care home visit, which is the most important way that we advocate on behalf of these clients and field staff with legislators. But again, questions, advocacy at heartsforhomecare.com. Check out the events page for upcoming scheduled learnings like this. And if no one has any other questions that I see in the chat, we will let you go. And we hope that everyone has a great rest of your week. Oh, we have one. How does an advocate get notified of Days at the Capitol? You will find out on the events page, #1. And you will also, if you're a registered Hearts for Home Care member, if you're on this call, that means you are, you will get an email to register for Days at the Capitol, either in a state or on a federal level. All right. With that, everyone have a wonderful rest of your week. And if you do have any questions at any time, advocacy at heartsforhomecare.com. Thank you to Marissa, Maggie, and Kevin behind the scenes for joining and helping on our end today. And I'll see you all hopefully next Wednesday for the public affairs and media training. Thanks.